for
Patients with
patients with
cancer.
cancer.
Here
Here
are
are
learning
learning.
objectives for today. We want to just go over a brief overview of some oral complications with cancer therapy, discuss the benefits of having good oral hygiene habits, and discuss the necessary for dental treatment, especially before beginning chemo or radiation therapy, as well as review oral hygiene techniques and tools to use during and after therapy, and some management and prevention. We'll review some products for home care. Okay, so when you're going through therapy, there can be many complications that's going on in oral health. That's because there's many cells that are being killed in your mouth, which are the cancer cells. But when you're killing the cancer cells, you're also killing healthy cells that's in your mouth. Also, when going through therapy, it can cause saliva to be thick or extremely dry. And without the saliva to act as a safe environment in your mouth, it creates an environment that causes decay, which are cavities that can start happening at a faster rate than you may normally have experienced before. When you are, so let's take a look at what happens in your mouth. Here are a couple of pictures that may happen. You may have experienced it or have heard about it. Pictures 1 and 4, they're labeled there, are due to low saliva that's in your mouth. So you're seeing a lot more cavities in your teeth. Picture 2 is what they call osteonecrosis of the jaw. Usually occurs in the lower jaw. Picture 3, you'll see some tissue swelling in the mouth. So these are radiation-induced or mucositis lesions. Picture 5 there, and picture 6. Picture 5 shows ulceration due to chemotherapy. This can lead to difficulty in eating, drinking, and even speaking. So this is also called like the burning sensation, and it usually happens in the beginning or the first week of starting chemo sometimes, with the onset of ulcerations that you see in maybe picture 6. So those are number 6 of mouth sores. Okay, you can also experience all these lists of complications as well. Poor healing is associated, of course, with chemo and um, therapy and radiation therapy, as a lot of your healthy cells are uh, lost. You may experience harder to speak, eat or chew, eat, talk, and chew. Um, Harder to fight infections, and you experience a larger increase in cavities, changes in taste, the dry mouth that we mentioned, jaw stiffness, and even oral sores. So one of the most common ones is the dry mouth, and right here you see a little bit of what's going on. You see you might see your tongue being more drier, and then your surrounding tissues in your mouth also dry. So when so it's very important to combat these challenges to reduce and combat these complications that we discuss. So you definitely want to visit the dentist before, during, and after treatment. So before, you want to get your teeth, your oral cavity evaluated, to discuss about how your dental health is looking, and discuss which treatment options you should consider prior to starting cancer treatment. By treating areas of concern, you can reduce possible dental side effects associated with chemotherapy and radiation. Some treatment options may include fluoride treatments, which we'll review, to prevent cavities, fillings, treating gum disease, removing infected tissue or storing any crowns or bridges, to ensure that you're able to chew your food properly and get a nutritious balanced um, meal every day. So during, you want to discuss any pain or complications to help combat challenges along with your oncologist. And after, you want to find yourself you might experience some dental issues or simply needing a regular checkup as you're working towards your best health. So don't forget to take care of your mouth. After all, it is a gateway to the rest of your body. So eating healthy foods with rich vitamins and nutrients can definitely help boost those immune systems. So when we talk about oral hygiene habits, you definitely want to start practicing this now and start making it more of a routine. So you definitely want to brush the 2 times a day for 2 minutes. We want to say that long because you definitely have many surfaces in your teeth and it takes a while to brush each surface as well. And you want to use always a soft toothbrush, soft or extra soft, never the medium or hard, as you're already experiencing probably brittle teeth or less stronger teeth. You want to definitely use soft or extra soft toothbrush, and you want to go over the area several times at an angle, and I'll show you the angle in a minute, 45-degree angle. And you want to brush your tongue last because that definitely harbors a lot of bacteria as well. And you want to remove that too. And use fluoride toothpaste. So here you see all kinds of different brushing techniques. The most common one we do recommend, and you want to discuss what's appropriate for what's going on with your mouth. Usually the most common one is what we call the circular technique, which is a brushing in circles. And you want to angle it same as a 45-degree angle as you see here, where it touches your tooth and your gums. So you're brushing effectively all along your gum as well as your teeth. Okay. So when I speak about fluoride, fluoride is definitely a natural mineral. It is found in many over-the-counter products as well as our community drinking water has fluoride in it. And what it does, it definitely helps to stop reverse tooth decay process and keeps tooth enamel strong and solid. So one should be using fluoride if undergoing chemo or radiation due to the side effects of the treatment. And this will definitely help your teeth. And then when we talk about flossing, you want to incorporate this as well, as many food gets stuck in our teeth, and many of the sugars are hidden between our teeth and underneath our gum, and it helps prevent gum disease. So you can see which is best for you to use, whether a string floss or a regular flosser, one-handed flosser. And what is important about this is you want to hug it against your tooth. And I'll show you a video in just a couple seconds on how to do that. But you definitely want to do that once a day. And then sometimes follow it with an oral rinse. Let's check out the video.
Flossing is an essential part of the tooth cleaning process because it removes plaque from between teeth where brush cannot reach, and also at the gum line, where gum disease often begins. In addition to brushing 2 times a day, flossing once a day will keep your mouth healthy. Wind 18-inch of floss around middle fingers of each hand. Pinch floss between thumbs and index fingers, leaving a 1 to 2-inch length in between. Gently guide floss between the teeth by using a zigzag motion. Be careful not to let the floss snap or pop between teeth. Contour floss around the side of the tooth, making a C shape with the floss as you wrap it around the tooth. Slide floss up and down and pressing against the tooth under the gum line at least 5 times. As you move from one tooth to the next, unroll a fresh section of floss from the finger of one hand while rolling the used floss onto the finger of the other hand. This technique applies to any type of floss, waxed, unwaxed, spongy floss, or dental tape. As long as you use the correct technique, the type of floss you use is a matter of personal preference. If you use a handheld flosser, the flossing technique is similar. To use a floss pick, be sure not to force it down between your teeth because it could damage your gums. Guide the floss gently between two teeth and be sure to avoid snapping or popping the floss. Use a gentle sawing motion. Once gently push the floss through the tight contact, pull the string tight against one tooth, and very gently scrape up and down to release the plaque on the tooth surface.
So there are other aids that you can use. You want to discuss what's best for you or if these additional items are good for you to use. So definitely discuss it with your oral health provider. And many of these products you can definitely find in your local stores. So Target, Walmart, Walgreens, or even CVS. And Amazon has been very useful um, uh, tool to use to find products that you're having trouble finding at the stores.
All right, guys, I'm going to take over for the next part, which kind of overlaps with what Christine was talking about. We have our nutrition. We want to make sure that we're eating healthy foods rich in vitamins and nutrients that can boost our immune system. Um, we want to make sure that we have foods that are lower in sugar if possible. And we want you guys to keep in mind complex carbs can also turn into sugars. So, not just candy and chocolates, but also chips and crackers, other types of foods that we might mindlessly snack on throughout the day. So just make sure that you're vigilant, hyper aware of what you're eating throughout the day. Also, acidic drinks and foods are harmful to your teeth. Not just regular sodas, but also diet sodas too. You're not home free if you just, have a diet soda. You think, oh, there's no sugar in it. There's also still acids like phosphoric and citric acids within the diet sodas. We want you to know that sticky foods are also not so good, like taffy, red vine, sour gummies, even granola bars. Some of our granola bars have hidden sugars inside of them and can also contribute. Uh, Also, sugar-free gum is a great substitute for candy, especially with xylitol. You can also use sugar-free mints as well. This is a diagram that I like to use a lot when showing people how much sugar uh, are in our everyday drinks. So you can see there's water, the typical things that you think, oh, what would have no sugar, what would have a lot of sugar, Monsters, Coke. But what I like to point out here is that there's chocolate milk, which is right next to the cola. The chocolate milk has only 3 grams less sugar than the cola. And you can see that a Red Bull has less sugar than the chocolate milk. So you really want to make sure you read the labels, look at the back of them, make sure you know how much grams of sugar are on your drinks. We also promote to avoid tobacco products. They're bad for our oral health and overall health, and may stopping may help your body heal faster. Even if you're going to be using um, what are the other types of devices, they still will have nicotine. They still have harmful chemicals that can harm your body. So I'm just going to go into a little bit more in depth about oral hygiene before. You want to talk to your dental provider and find out the dental treatment options by treating areas of concern. You can reduce or lessen the dental side effects associated with chemotherapy and radiation if you do so. National Cancer Institute recommends seeing the dentist at least 4 weeks before, or even more time before would be great, before beginning your chemo or radiation. Again, just reiterating everything that Christine was saying, brushing your teeth at least 2 times a day, flossing, having all treatments done, including deep cleanings, avoiding the sugary foods and drinks, and try to avoid mouthwashes that contain alcohol. There are some Listerines that have the alcohol still, and it can cause like a burning sensation on the tongue. Um, let's see here. We have oral hygiene during. Um, Make sure to give your dentist your doctor's contact information so that they can both communicate with each other to make sure what's the best treatment for you. Basically, again, same instructions as before with some modifications. Keep your mouth moist by drinking water, sugar-free gum and mints, and saliva, trying to stimulate the saliva flow. Exercise those jaw muscles at least 3 times a day. Use a soft bristled brush. And if irritation with brushing occurs with your toothpaste, you can use like a quarter teaspoon baking soda with 1 cup of warm water and continue using mouth rinses that promote saliva flow. If you have dentures, you want to just make sure to keep them clean using those effervescent tablets, using also Vaseline or lip balm to prevent cracking of the lips. And then oral hygiene after, continue routine dental care, follow up with a dentist regularly, even more so than what you think might be normal. I would say between 4 to 8 weeks or 1 to 2 months for the first 6 months. Daily applications of fluoride gel might be proposed by your dentist or doctor for patients with the xerostomia or dry mouth. And, just have the good oral hygiene habits during uh, and after treatment so you can avoid serious problems and infection. So these are some of the things, again, just to reiterate what Christine was saying, we have over-the-counter products that you can get at CVS, your local grocery stores, the Act mouthwash, Biotine to help the saliva flow for dry mouth, Colgate Peroxyl, and then prescription mouth rinses that can be prescribed by your dentist or doctor, chlorhexidine, and the Prevident ClinPro toothpaste. There could be other brands as well. They will do the same exact thing. And then different home care recommendations. So rinsing will help food and debris off of your teeth and gums, and avoid rinses that have alcohol in them, like I said before. Just make sure you rinse often, along with regular brushing and flossing, which will help reduce the chance of the dental decay and infection. So these are different things you can do. 1 teaspoon of salt in 4 cups of water, a teaspoon of baking soda in a cup of water, 1/2 teaspoon salt, and 2 tablespoons baking soda in 4 cups water, just different remedies there. Um, and then I'll just go over our summary of everything that we've talked about here. Just perform all cleanings and dental work before the start of the cancer treatment. Just to reiterate, maintain diligent oral hygiene practices of flossing, brushing, and rinsing. Keeps xerostomia to a minimum, the dry mouth. And then you want to make sure that you have your proper nutrition, restrict or end the use of tobacco products if possible, and use the prevention products like what I just said, the over-the-counter rinses, fluorides, prescription fluorides, and toothpaste that will help you. All right, guys, thank you so much.
Thank you. I just want to thank you very much. But
Okay, can see it. Hola, bienvenidos. No tenga ninguna relación con las compañías. Buenos días, mi nombre es Rebecca y yo soy profesora asistente de la Facultad de Odontología de USC y también soy higienista dental. Amo ambos trabajos. La salud oral, el cáncer y ustedes. ¿Por qué? ¿Cómo? La presentación ahorita trata sobre el manejo de las afecciones bucales derivadas de los efectos secundarios de la quimioterapia y radiación. Y la presentación es manejar las condiciones de ayuda a seguir adelante. El panorama general es para reducir la posibilidad de infección y ayudar a la boca a sentirse cómodo. Am, es importante que la boca se siente gomada para poder comer. Y necesitas como alimentos saludables, naturales, para funcionar bien, para ir a la escuela y para trabajar. En la salud bucal es parte de la salud en general. Sí, es verdad. Complicaciones orales asociadas con la quimioterapia y la radiación pueden afectar tu calidad de vida. Pueden causar anorexia, depresión, desánimo, pérdida de sueño, dificultad en comer, tragar y hablar. En Primero, los dos conceptos importantes que debemos saber. Los caries pueden causarte dolor, pero muchas veces no, pero muchas veces no. La cavidad puede crecer si no se trata a tiempo. Las caries pueden ser de color amarillo, marrón o negro y también poquito o grande. Necesitas ver, necesitas ver. Cuando tú tienes suficiente saliva, el ácido y la placa pueden causar caries. Y hablando muy rápido, lo siento. Es importante aprender que debes consultar con un dietista antes de comenzar el tratamiento, saber reconocer los síntomas en la boca, que son efectos secundarios, ah, conocer cuáles son los productos y remedios que puedes usar en casa, en aceptar sugerencias para que te sientes bien cuando comas y tu boca se siente cómodo y sin ah, molestias. Efectos secundarios. Cuando digo efectos secundarios, estoy hablando sobre las condiciones en la boca son causadas por el uso de medicamentos o tratamientos. Es importante saber cómo manejamos estos efectos secundarios para prevenir problemas serios que pueden surgir. Bien manejo te ayudará a terminar con éxito tu tratamiento y te ayudará a sentirte cómodo todos los días. Para continuar con tu tratamiento y que tu boca se siente cómoda, es necesario entender los efectos secundarios y saber cómo manejarlos. Y así podemos compartir nuestro conocimiento con los demás. Cuando dental antes de quimioterapia o radiación, ve un dentista antes de comenzar el tratamiento. En evaluación, oro o tratamiento antes de la quimioterapia y radiación. So, primero comenzar y antes examinar el tratamiento dental con tu dentista, limpieza dental profesional con higienista. Educación sobre higiene bucal. No se aconseja el consumo de alcohol ni de tabaco también. En ahora aprendamos qué condiciones pueden pasar. ¿Qué tipo de problemas bucales puedes ver o sentir? Si tienes, usa un espejo y buena iluminación para ver tu boca. En la clínica es muy fácil para nuestro tu ver en la boca, pero necesitas en casa usa un espejo en muchos luz. El tratamiento de cáncer destruye células, pero durante el tratamiento también se pueden dañar las células normales. los efectos secundarios que producen la quimioterapia y la radiación en la boca pueden incluir problemas como qué es la mucositis? Es la inflamación dentro de la boca y úlceras. Comienza alrededor de la segunda semana, like 1 week. La 40% de los pacientes experimentan mucositis. Pues mucha gente. Se desarrolla. Las mucositas se desarrolla entre 7 o 4 días después de la quimioterapia y después 2 3 semanas de radioterapia. Generalmente desaparece a las pocas semanas. Los efectos de radiación as productos para los microcitos. So, this is the manejamos. Enjuague bucal con gluconato de clorhexidina es en receta, prescription. Enjuague bucal es antiséptico. La gluconato de clorhexidina es antiséptico. Es posible tienes boca seca, esa sensación de cuando no hay suficiente saliva en la boca. ah, en- es común, es muy común. ¿O cómo tratar las mucositas? Mantener buena hidratación, beber agua con frecuencia o chupar trocitos de hilo. Evitar irritantes o alimentos altos en azúcar. Evitar alimentos ácidos o picantes. Evitar alimentos en temperaturas extremas. Se recomendaría suavizar la comida con líquidos. So, agua o jugos, espina. Ah, evitar antiinflamatorios. In inglés, they're called NSAIDs, non-steroidal anti-inflammatory drugs. Um, muchas veces leer NSAID, but it's anti-inflammatorios and no de. En la serostomía, las glándulas salivas no producen saliva y sientes la boca seca. And esto puede causar caries, ¿sí? ¿Por qué? Porque la saliva lavas los dientes. Cuando no tienes saliva, ahí ahí es posible xerostomía. So, los productos para la siguiente xerostomía es fluoruro, like un enjuague bucal. También usa goma de mascar sin azúcar para producir saliva. So, usa goma de mascar para producir saliva. Um, en inglés, candidiasis, la candidías, también pueden ser resultado de la quimioterapia, es posible. En productos recomendaría por candidiasis es mismo, clorhexidina. Su quimioterapia de radiación es posible infección de mucositis, disfuncionales de gusta, pérdida de peso, desnutrición, porque la gente deja de comer por el dolor. That's de maestra, la doctora, Dr. Suárez, dice. En otras partes de la boca que pueden ser sensibles es el cachete, en la lengua. Es posible. En papilla gustativa, Las papillas gustativas son órganos sensoriales que nos permiten percibir los sabores. Las papillas gustativas pueden alterarse con quimioterapia y radiación y el sabor de los alimentos pueden verse alterado temporalmente. Es importante, temporalmente. El sabor de alimentos pueden ver alterado temporalmente. And ella dice, sabe a nada. Las apps no son contagiosos, no son contagiosos y desparacin por sí solos. Una semana, 2 semanas. Ahora hablemos sobre productos para el cuidado bucal. Ok. Compra en la tienda. This Act es el nombre del producto. Es 0.05% fluoruro. Y biotin, otros productos, si se puede comprar en la tienda. Lo siento. Productos biotin. Este medicamento se usa para tratar la sequedad en la boca y garganta. Biotin es productos es saliva artificial que humedice y limpia la boca. También alivia las llagas en la boca, también conocidas como mucositas causadas por la radioterapia y quimioterapia contra el cáncer. En otro producto sin alcohol y con barbonate es Listerine sin alcohol, cero alcohol. En pasta Arm& Hammer es muy buena. Otro producto puede comprar en la tienda es Peroxol enjuague oxigente, elimina residuos bucales. Y Peroxol se utiliza en la facultad de ontología. Sí, usamos a la escuela. En productos sin receta es Act, Biotin o Colgate, pero chlorhexidine necesitas receta, es prescripción. En pasta de dientes necesitas receta, es Prevident. Y busca este sello en los productos, es American Dental Association. Siga las instrucciones del producto, pero busca este sello en los productos aquí. ADA, accepted. Es importante productos y remedios. Queremos usar estos productos y remedios para ayudarte durante este proceso. Um, so, es importante cepillarse los dientes cada día, usar hilo dental y también si vomitía es muy importante. Es posible, sí, si vomitía. Suavizar el cepillo en agua tibia, usar hilo dental suave y usar un cepillo extra suave. Y si sangra de semiazo, use una gasa humida para limpiar de los dientes y los tejidos blandos. And ver a recipe for un 4 de cucharita de bicarbonato de sodio y 1/8 de cucharilla de sal en una taza de solución de agua tibia. ¿Ok? También chlorhexidine enjuague bucal antimicrobiano. Es antiséptico. Necesitas receta, pero sin alcohol. And usa hilo dental y cepillarse los dientes. Cepillarse los dientes por 2 minutos. Después comer y, again, otra vez, si vomita. Para mejores resultados, limpie sus dientes antes de usar productos. También use enjuagues, pasta de dientes, pasta con fluoruro, hilo dental. Y fluoruro varnish, el barniz de fluoruro es aplicado por el higienista dental. Fluoruro es mineral, natural. Y así, proteja tus dientes. ah, ah, otra vez, uso goma de mascar y pastillas garganta para producir saliva. Necesitas saliva. Cheque, you're like, yo tengo saliva? No. Okay. Use líquidos con comida. Use goma de mascar y pastillas. Y enjuague bucales con fluoruro y antisépticos. Comprar los productos aquí. And these videos es para ti. Si te gusta, después la presentación, porque this is for like 5 minutos. And it's importante, es como cepillarse los dientes. Y otro, ok. Otro, cómo usar hilo dental. En pocos puntos. La mucositis es previsible, generalmente no se pueden prevenir. Y en el otro pilito, leer, eso es en mis referencias de Silo et al. 2019. So, ¿estás preparada? ¿Estás informada? ¿Estás informado? Es todo, pero one more thing. Yeah. Una cosa más. Vamos a jugar. Ok. ¿Qué es serostomía? Dígame. A, sequedad en la boca, o B, hacer fotocopias. ¿Qué tú piensas? Sí, Elena dice A. Gracias, Elena. Es correcto. Sequedad en la boca. Muchas gracias. En gracias. En recuerda seguir luchando. Fight on. And you can email me. Tienes preguntas. En gracias.